Let's talk about what is hantavirus and how it is different from COVID-19 or coronavirus 2019. Hantavirus belongs to a group of RNA-containing viruses. These viruses are carried by rodents, means mice and rats, and responsible for causing severe respiratory infections that are called hantavirus pulmonary syndrome (HPS) and hemorrhagic fever with renal syndrome (HFRS). Hantavirus pulmonary syndrome is quite rare but fatal. The disease spread from mouse and rats. These animals shed viruses in their saliva, urine, and droppings, which are then entered into air. If a person inhaled in air infected from these saliva, urine, or droppings, then he can become ill. The good thing is, this disease is not transferred from one person to another. Let's see what is the incubation period of this virus. The incubation period of hantavirus is not commonly known. However, from limited information we have, it is assumed that the symptoms appear between 1 and 8 weeks after the person exposed to contaminated air. Let's talk about the signs and symptoms of this disease. The early symptoms include fever, fatigue, muscle aches, especially in back, thighs, hips, and shoulders, chills, dizziness, headache, abdominal problems like diarrhea, vomiting, nausea, and abdominal pain. If we talk about the late symptoms, then after 4 to 10 days of initial phase, coughing and shortness of breath appear. A person feels like his lungs are filled with fluid, and also he faces difficulty during breathing. The disease is fatal and it shows 38% mortality rate. Let's talk about the treatment of hantavirus infection. There is no specific treatment or cure is available for this disease. Even vaccine is not available for the disease. If a person lives around mice and found these symptoms, he should visit doctor. By intensive care, the health of patient can become better with time. Some preventive measures can be used to avoid this disease that include close the holes in house, remove easily available food for mouse, and use mouse trap. This method can help to reduce the mouse and help the person to prevent himself from getting this disease. There are some similarities between COVID-19 and hantavirus infections that include both COVID-19 and hantavirus affect lungs. They both show similar symptoms. No vaccine or treatment available for both of these viruses. If we see at the difference between COVID-19 and hantavirus infection, here we have a good news regarding hantavirus. COVID-19 can be transferred from one person to another. That has made it a pandemic disease that is hard to control. However, hantavirus cannot be transferred from one person to another. Only the person who comes in contact with mouse dropping or urine or feces can be infected. That was all about hantavirus and its infections.